Hello, I'm Dr. Ekberg, and we would just like to share a story to help some people see what chiropractic can do. This is Raghav. Thank
Hello.
you for joining us. Could you just briefly tell us what your problem was when you first came to see us?
My problem was I was having a lower back pain, and even if I lift not very heavy box or anything which is little bit heavy, I used to get a back pain for a longer period.
How long have you had it when you first came to see us, and what had you tried? What other things had you tried before that?
It was there since 2008, I guess, because I remember one time something happened, and for 10 to 15 minutes I kind of froze in my office chair that I couldn't get up, and that kind of scared me. Then I went to spinal surgeon, and then we took an X-ray and other details, and he said everything seems fine, maybe you just had some kind of a pinched nerve or something like that. And then that lasted about more than a week, and I was having medium to mild pain, but I was taking painkillers, and I took for a month those painkillers and I felt good. But another 6 months later, when I lifted my car seat, which is pretty heavy in a van, and then again I felt, usually I used to lift that pretty easily.
Yeah.
But then again it started, and then again it lasted again for another 2-3 months. I took those medicines, diclofenac 175 milligram for 6+ months, and whenever I used to take the medicine I used to feel better. And then when I stop it, and if something happens like this, like lifting very heavy, not even very heavy item, I used to get a back pain again.
Yeah, because the medicine covers up the symptom. It doesn't fix the problem.
Yeah, that's what I noticed. And when I watched some videos from your website, and that time I felt, these medicines are going to, just cover up or band-aid the overall symptom. But they don't actually cure.
Yeah.
It took more than a year to find a good doctor like you.
After you started seeing me,
Uh-huh.
how long till you had some relief?
Oh, within 3 months I felt very good without taking any kind of a painkiller or anti-inflammatory medicines like diclofenac. I felt much better, and I feel much fresh. Not only that, the other techniques you mentioned about breathing and how you need to be relaxed, those helped me with my stress related symptoms what I had. And I was taking some other medicine for my stress related symptoms, and that really helped me a lot to get off those other medicines, because one thing I learned, that medicine doesn't cure anything.
You said it took about a year. You were looking for a year?
Yeah, I know that I need to find a good doctor, and I visited a couple other doctors whom I found through some social living website, like getting a deal and finding somebody. And that time I noticed that the other doctor, the difference between Dr. Ekberg, you and other doctor I found is, you do this muscle test, and that really, because I'm an engineer, I know that how to fix the things is like trying to find what is wrong in it, not rather than trying randomly and fixing it. The other chiropractor I visited through Living Social, I found that they just do 1 or 2 adjustments every time you go, and then they say, okay, you come back. And that's what I did not feel comfortable with that type of approach. When I learned about the way you treat patient, that really, made me, being an engineer, that you're trying to find where the problem is and trying to fix that problem. And that's why, I said, let me continue with you. And I have been here since 2012 with Dr. Ekberg. Yeah.
And now you're just coming to basically maintain function.
Maintain
right?
functions, and sometimes I get back pain if I don't come that often. So I realized that this needs to be maintained. Yeah.
Mhm. So you were with us in our old location in Alpharetta, and now you're seeing us in Cumming. So how far do you come to get here?
It's about 15, not even 15, like 10 miles, roughly 8 to
Okay.
10 miles. And it's a mental block in many folks, including myself, is like we can drive to downtown and say it is not that far because we consider that as natural drive pattern. But when something up north here, we feel, oh, this is far. But I realized that if a doctor is good and right doctor, we should drive up north also to visit the doctor who is very good in treatment what you do. Yeah.
Very good. Thanks so much for sharing. Hopefully we can have some other people understand a little bit more. Thank you.
Yeah.